Okay, good afternoon, delegates. So we are on live to the next plenary session, which is plenary 5 of the second day of the 52nd Annual National Conference of the Chartered Institute of Personnel Management of Nigeria. So with us this afternoon to take us through the journey on returning safely, supporting a safe return to business post-lockdown is the president of the Institute of Occupational Safety and Health, IOSH, Mr. James Quinn. And many of us will be aware that the Chartered Institute of Personnel Management of Nigeria, we are in collaboration with IOSH on a lot of initiatives around safety, especially with the recent trends in the area of mental health. Again, lockdown caused by the pandemic has really brought about the need for us to pay more attention to the emotional and physical well-being and the safety of workers, especially in the employment space. So I want to yield the floor straight to James Quinn to take us on this journey after the first 30 minutes to take questions and answers. Please, if you do have questions in the course of the presentation, kindly look at the top right corner of your screen. You will see the Q&A button there. Just click on the Q&A button and post your questions there. I will be able to take them after the presentation. James, over to you now.
Thank you so much. Well, good morning, good afternoon, good evening, wherever you are in the world watching today. My name is James Quinn, and I'm the President of the Institution of Occupational Safety and Health, IOSH, and I'm delighted to be with you today to outline how IOSH and the guidance and role of occupational safety and health, OSH professionals, have supported businesses in returning back to safe and healthy ways of working post-lockdown. So, in case you're new to IOSH, here's an overview of who we are and what we do. The Institution of Occupational Safety and Health, IOSH, is the world's largest membership organisation and only chartered professional body focused on safety, health and wellbeing in the workplace. We have over 47,000 members in around 135 countries. We act as a champion, an advisor, an advocate and trainer for safety and health professionals working in organisations of all sizes in most sectors. And our focus is to support our members in their efforts to create workplaces that are safer, healthier and more sustainable for everyone. As well as being a professional body and membership organisation, we're also a thought leader and an enabler working collaboratively to help organisations around the world excel in safety and health. IOSH recently signed a memorandum of understanding with CIPM to collaborate, to share knowledge and skills across the HR and OSH functions in businesses as both organisations look to improve the lives of people at work. Now, during these extraordinary times we find ourselves in, IOSH believes that human resources and occupational health and safety professionals share a common responsibility to help people worldwide deal with and limit harm caused by the coronavirus pandemic. Our professions, more than most, are equipped not only to assess and manage risks and hazards, but also to enable recovery from this crisis in safe, healthy, sustainable ways. We know that as well as tackling the new COVID-19 threat, populations need ongoing access to essential products and services for their daily needs too. And that, to help make sure this is provided, all the usual OSH risks and the more recent ones must be properly managed, with action set against a background of more social and economic stress. IOSH has been committed since the start of 2020 to sharing the best available information about COVID-19 as it developed, supporting its members, partners and training providers. While the spread of this disease was hard to predict at first, everyone soon had to strive to prevent further illness and protect at-risk staff and those returning ill and vulnerable people. This session will look at how IOSH and its members and training partners have responded and continue to respond to the current pandemic. I will touch on our Returning Safely campaign, how businesses can manage the risks associated with a second wave and local lockdowns, and also our calls to action and policymakers. Organisations will already planned approaches to returning to the workplace following the COVID-19 lockdown, and they will be executing those plans in organisations across the globe. Businesses have been working hard over recent months to protect colleagues, customers and clients, and as human resources and occupational safety and health OSH professionals, we have played a huge part in that return, ensuring businesses are returning to a safe world of work. I hope this presentation will help to reinforce that organisations are on the right track and provoke thought on ideas to enhance that approach. First, I'd like to tell you about IOSH's initial response to the pandemic. On the 16th of March, we began to communicate how we were supporting our members, especially at this difficult time, and we contacted our training partners to show our support, rapidly working with them to move our courses online. Very quickly in March, IOSH redirected all its work, researching, writing, designing, communicating and disseminating advice and guidance to produce content focusing on COVID-19 material. We created a knowledge hub at www.iosh.com/coronavirus that continues to grow as the pandemic response changes. This has involved helping businesses initially with workplace hygiene and preventative measures, then supporting managers and staff with adapting rapidly to healthy remote working. Based in part on previous IOSH funded research, as well as the ergonomics of home working and working from home mental health. So far, we've had more than 50,000 views of the main coronavirus web pages and more than 20,000 to our Returning Safely pages. More on Returning Safely later. In providing this advice and guidance, we established support for our existing members as well as answering demand for IOSH knowledge. This strengthened our position as an expert source by delivering accessible, relevant and regular guidance by subject matter experts. We reached out to our partners and global national bodies that approached us to use our expert content to support their own members, something which we are glad to be able to share with you, the CIPM members. At the start of April, we ran the first of our now very popular series of 3 weekly COVID-19 webinars, partnering for this first session with the World Health Organization. Over 5,000 people registered for this, and the webinars have developed into a popular, insightful strand, attracting thousands of participants and representatives from many organisations. The purpose of the series was to support OSH professionals, industry sectors and businesses at an unprecedented time, and so far we've had speakers from, as mentioned, the World Health Organization, UN Food and Agriculture Organization and the World Trade Organization, the Chartered Institute of Personnel and Management and Make UK, as well as hospitals in China and Italy, heads of safety and health for health services, insurers, supermarkets, shipping, logistics, multinationals, along with, of course, CIPM CEO Basola Alofi. So far, attendance at these COVID-19 webinars in particular has totaled more than 20,000, and IOSH as a whole has delivered sessions to over 150,000 people during the pandemic so far. We have been able to offer guidance on office returns, mental health, resilience, effects on supply chains, the strains in the health sector, and the issues facing the travel sector, amongst other areas of importance. Many thanks to you as well if you have joined one or more of our interactive sessions. We hope you found them useful. These webinars have been recorded, so if you've missed them so far, I recommend that you visit the IOSH COVID-19 pages. Check out the content and view a recording if it's a particular topic of interest. Alongside this, we communicated widely with our audiences and partners, audiences through social media and traditional media, to share advice on how businesses should support, prevent, plan for return to work, with businesses to embrace the role of OSH colleagues to respond to emerging risks. Our Chief Executive, Bev Messenger, who you will see present tomorrow, will share advice on the importance of your people and the value that can be placed on good practice in the workplace. throughout this crisis and beyond. IOSH Media Relations gained coverage with our call to government and businesses to put health and safety first, to avoid work environments becoming places of transmission for the disease. IOSH have invested exceptional efforts improving services for members, so we offer our full service under remote conditions. We continue to enhance online support and encourage the IOSH community spirit, sharing of knowledge and mutual support. Using technology available to us, we accelerated the launch of our mentoring platform and careers hub for members. We recognise that additional support for our members at this time is vital. By collaborating with the Institute of Directors, the Chartered Institute of Personnel Development and other partners in the UK, we are already raising the profile of the OSH profession. And IOSH within the business community will providing credible knowledge and insight to their audiences to enable success, prevention, business continuity and resilience as organisations move through phases of redeployment into recovery. We look forward to working with CIPM and you to achieve this here. To offer additional support to health and social care workers, we cooperated with the Faculty of Occupational Health Nurses to distribute their relevant content via our network and their channel to the health services to position our content. Supporting healthcare workers is in everyone's global interest as a charitable activity for IOSH with far-reaching potential benefits. We have also run 2 global surveys for the World Health Organization to capture intelligence about what prevention and control methods work most effectively for key workers and health and social care workers. The findings from these are being analysed to inform updates and improvements to global guidance and advice. Now, as organisations that paused activities or moved to remote working for weeks began to plan to take forward returns to the workplace, IOSH launched a new phase of advice and guidance focused on returning safely, which everyone and anyone can access at www.iosh.com/returning safely, which is on the slide. With COVID-19 lockdown measures easing in many parts of the world, you may now need to support the safe return to workplaces. This presents various challenges, especially with restrictions such as social distancing still in place. This online hub advice and resource will help you navigate a safe path with guidance in our 4 returning safely areas: safe people, safe workplaces, safe systems, and safe equipment. And we developed 3 e-learning modules to help support employees and managers on the safety and health risks during COVID-19. More than 5,000 people have taken one of our e-learning modules so far, and I'd recommend using these free resources in your organisation, please. At the same time, we set out our policy position, and it will no doubt resonate with all of you on this session. We say health and safety must come first when considering restarting work during the COVID-19 outbreak. Protecting workforces and communities and enhancing engagement and productivity. For organisations, it's about a systematic plan, do, check, act approach, and forward-thinking employers have already been planning for safely restarting work once allowed.
Sorry, James.
Yes.
Just a minute. You can't seem to. Are you sharing your slide?
I am.
No, you're not, because we can't see your slide. We can only see you. So please try and check again on the slide share.
Let me go in. I don't know what's happened.
Just look for the button again, share button. So click on it, then click on the slide.
I am.
Okay, the slide is on now.
Is it there?
Yes,
You can
it's on
see
now.
the safe people slide.
Safe people.
Okay. I
Yes.
thought you. Okay, one moment.
So we can back like. Let's take it from there.
Is it okay? You can see everything? You can see safe people, yes?
Yes.
Okay. I'll continue on. Apologies. Okay. Safe people. Okay. So let's take a look at these 4 areas: people, workplace, equipment, and systems. When it comes to safe people, we advise assess COVID-19 related risks and protect all workers, including the vulnerable. Ensure that only those workers who can't work from home and who can work to return safely do so. Provide adequate training, consultation, communication and awareness with a means for workers to raise concerns. Support ergonomics and well-being for home workers. In the safe workplace, we advise that you need to provide physical distancing, signage, distance marking, barriers, one-way systems, staggered start-finish break times, reduced numbers. Improve hygiene, washing facilities, hand sanitizer, regular surface cleaning tissues and disposable services. Improve ventilation arrangements. Redesign processes to reduce risks, including, for example, retaining teleworking. On safe equipment, provide necessary personal protection equipment and safe use guidance. Support appropriate use of face coverings for reducing the spread to others as a complementary measure explaining its limitations. Check heating, ventilation, lighting and hygiene arrangements. Ensure safe recommissioning of plant and equipment and statutory inspections. On systems, review, update and communicate all risk assessments in the light of COVID-19 security requirements. Ensure workers who are symptomatic know they shouldn't be at work, and anyone who develops symptoms is isolated and sent home. Check fire safety, first aid, water and asbestos management arrangements. And finally, offer ongoing mental health support and flexibility for work-life balance issues. The well-being of the workforce and the importance of the work-life balance is something organisations globally are prioritising. There are a number of things organisations can do to keep their workforce happy and healthy during this difficult time. Communicate the organisational plan by being open and honest with all workers and ensure clarity. The workers have a right to know what the organisation is doing to protect its workers and to help them to return to work safely. Good leadership is imperative. Keep in regular contact with remote workers. This will help to avoid feelings of isolation and loneliness for those that are unable to return to work immediately. It's a good way to ensure that workers are well and they understand information and instructions being presented to them. Organisations must also remember that remote workers still need to be cared for and that they are also a part of the return to work after COVID-19. Set boundaries for working hours. Allow workers to disengage from work. Let them know when they're required or to introduce reduced working hours to begin with. The emotional stress for some of those returning to work may be very high. Showing compassion and flexibility will allow workers to feel more secure and safe when returning to work. This will also allow workers to continue a healthier work-life balance when they return home after work. Encourage workers to discuss well-being, mental health concerns. This can help to alleviate symptoms and prevent them from worsening. It can help to create an open and compassionate culture, which could lead to a more socialised reintegration into the workplace. It also allows managers the opportunity to learn about potential preventative measures that could be adopted for the future. Adopt an approach to provide positive, morale-boosting messages and positive information to workers. Provide and promote positive information around the organisation to help workers to feel more stable during the return to work. This can create more positive mindsets and provide rational, logical thinking and reassurance. Reassure workers that it's okay to be fearful, apprehensive and frustrated during the return to work process. These are normal responses. Motivate workers through praise. Ensure that workers are rewarded for their work. A morale boost can help to raise well-being to a more positive state. A simple well done or a smile can make a big difference. Organisations can also play a vital role in an employee's mindset and actions through this difficult time. Offer general well-being information. The messages for general health promotion are as relevant as they were before, but a bigger emphasis on disseminating health information and messages may be required. For example, highlight useful resources and sources of information that focus on well-being and mental health. This could be in the form of advice, online or mobile applications. Encourage healthy sleeping. Encourage workers to get plenty of quality sleep. This can help workers to keep healthy, be more productive, and more resilient and open to workplace changes during the return to work process. Stand regularly. It's important for workers to take regular rest breaks and to stand up often to experience health benefits. Extra movement, stretching and physical exercise can enhance the health benefits. This can also encourage social interaction. Partake in socially distanced physical activity. Encourage workers to perform some sort of physical activity or exercise, as this can help with their mental and physical well-being. Exercise should be performed whilst abiding by social distancing measures. Eat nutritious food. A healthier diet can help the body to fight off infection and raise overall health levels. Encourage workers to partake in controlled breathing exercises. Deep and controlled breathing can help workers to relax when stressed. Encourage good standards of hygiene. Educate workers in the importance of good personal hygiene and maintaining good hygiene of working equipment. For example, wiping keyboards. And in a very demanding time, employers can provide varied tasks if possible. Try to offer some variety of work to allow dynamic thinking and working during the return to work transition. This will help provide fresh cognitive challenges and allow workers to feel stimulated, motivated, and overall, and essentially, productive. Allow flexibility to help workers manage their own health and that of others during their return to work. Allow them to take extra rest breaks if required and to address other concerns or issues alongside their working. Ensure that work deadlines and timescales are reasonable. This will help reduce stress. Alongside issuing advice in these areas, we also share global guidance on legal obligations. Employers will have many questions on how they keep their businesses safe and legally compliant during the crisis. With 195 countries in the world, it's difficult to give specifics about legal compliance in each country in one article. The International Labour Organization, Global Database on Occupational Safety and Health Legislation, IOSH, provides a picture of the regulatory framework of the main elements of occupational safety and health. These include IOSH management and administration, employers' duties and obligations, workers' rights and duties, IOSH inspection and enforcement, among others. These will provide the basis for IOSH principles that an organisation can follow to keep their workers safe, including duties and responsibilities to protect the safety and health of workers and others in specific hazards and risks. For a full guide, please do visit our Returning Safely pages on the IOSH website. As we give advice on risk assessments, the measures you use will depend on the outcome of your risk assessment. As isolation is eased and people return to work, governments may require organisations to complete risk assessments as part of the permission to return to normal service. This guide suggests how this could be achieved. For ease of description, this guidance focuses on producing a separate risk assessment for COVID-19. It is equally valid, however, to amend existing risk assessments of activities by using information prompted in this guide. Risk assessment covering exposure to COVID-19 will be different from one organisation to another. Healthcare workers, retail cashiers, home delivery drivers, utility engineers and construction workers have different exposure to this risk. The purpose of this downloadable guide is to therefore to pose the questions that need to be asked so that appropriate risk assessments may be created in all industries. We have not provided a recommended template for this assessment, but instead used headings that are common in most organisational risk assessments. And that brings us to where we are today. We are now living and working alongside the COVID-19 virus as it spreads, subsides and then spikes again in unexpected ways among populations, communities and workforces. This virus exploits weakness in controls and safeguards as well as human behaviours at home and at work. The pandemic is at different stages of development in different territories around the world. Now in places where infection rates and the reproduction rate, or R number, are declined in recent months, latest data shows COVID-19 cases are resurgent again. Affected cities and regions have been extending or introducing restrictions on travel, movement, size of social gatherings, and what venues and businesses can operate. As you will know, these are known in some places as localised lockdowns, and in common with enhanced quarantine measures for international travel. They can be imposed suddenly, taking on various forms. When risks subside, these restrictions are relaxed, but they can be imposed again without much warning when case numbers begin to rise again once more. These fundamentals help employers ensure they can continue to operate well while navigating our very different, less predictable world of work, from making sure necessary restrictions are in place, work well and are enforced, to looking after the communication needs and mental being of all workers. On our Returning Safely pages, we have collated information that can help you tackle this next phase, including a recent COVID-19 webinar, Managing Your Work Safely Through Local Lockdown. Please visit our site to access these. And finally, our calls to action, how we all as employers, employees, colleagues and professionals can take this next step forward. Assess and manage your COVID-19 risks and ensure safe working is resumed safely. Show strong leadership and focus on worker engagement. Protect vulnerable groups and focus on the higher risk of serious illnesses, such as workers with underlying health problems. Provide ongoing physical and mental health support. This is essential in recognising that some effects may be long-lasting, and consider the needs of all workers, including those on the front line. Extend your risk management into your supply chains, ensuring those who are self-employed or work in the informal economy are also supported to stay safe and healthy. To find out more about our advice and guidance on COVID-19, you can do any of these things shown in this slide. We are constantly updating our guidance and collating resources from other authoritative sources. We are also rising to the challenge of this global pandemic, but there is still a long, long way to go. Let's tackle it together. Finally, thank you so much for listening, and thank you, the CIPM, for having me here today. I'd be happy to take comments.
Very, very interesting insights. Very, very interesting insights. They were just nuggets straight to the point on the topic. Show compassion to workers, encourage workers to discuss their well-being. Positive morale boosting information should be provided to workers. Motivate workers through regular praise. Encourage healthy routine. Promote healthy habits. Stand regularly and intermittently during work hours. Don't just sit down for too long. Encourage workers to exercise regularly. Control breathing exercise should be encouraged. Allow flexibility to help workers work better and reduce stress, and so much more. This has been a very, very interesting and very insightful, excellently delivered paper, just straight to the point and very succinct. Yes, a lot of comments in the live feed that we have here, James. I'm sure you are seeing the live feed. So many comments there for you. Wow, thank you, and all of that. So let's quickly dive into the Q&A. I'm seeing a couple of questions. Let me take this particular one from Nene Noli. It says, can a staff litigate against an irresponsible organization that does not take employee health and safety serious with focus on COVID-19? Please advise what steps employees should take to prevent frequent harassment of staffs in this regard. James, you need to put on your microphone. You need to unmute yourself. Okay?
Yes, of
All right.
course. The new statement of the world, you need to unmute. I don't know how it would work in Nigeria or around the world. However, in the UK, there would definitely be steps that any worker can take, and that includes speaking to the health and safety team on site if they have any issues or any problems. You can always speak to the health and safety, especially on the sites that I work on back in the UK, confidentially. There's confidential phone lines. There's ways of informally mentioning to people what's going on, their anxieties, because that's important. And I know that I've had many people come to me with not problems but ideas and issues that they may have had, and they're rectified straight away. It's a collaborative approach. We're all in it together. And that's how I would deal with it, and how we would deal with it here in the UK. Around the world, I'm sure there are similar organisations and similar ways of speaking to people to assist in these issues.
Okay. So David Ukago says, COVID-19 requires lots of flexibility. So what is IOSH perspectives on reward management, particularly for staff who need to continue to work home and are unable to return to work but still meeting work targets?
What are IOSH doing to assist in this?
Okay, let me take that again.
Yes.
COVID-19 requires lots of flexibility.
Yes.
So what are IOSH perspectives on reward management, particularly for staffs who need to continue to work from home and are unable to return to work, but they are still meeting their work targets?
Yeah, well, if I got that question correctly, IOSH are leading from the front here. Not only have they involved in the research of working from home, but they're also leading from front in a lot of the IOSH staff are working from home as well now, and leading from the front on that. And IOSH has released lots of resources online to assist with the working from home issues that people may have. So yeah, if I've got the question right, there's plenty of online resource to assist in that, and IOSH are well behind that as well. I lost the connection.
Okay, can you hear me now?
Yeah, I can. I lost your connection. I can hear you now.
Okay, what's your perspective on reward management and performance management for staffs that are working from home? Yeah, and they are still able to meet their deliverables?
I don't believe there's any difference. There's still the same work that needs to be done. There's the same sort of timelines, only probably a little bit longer. I don't believe there's any reward management here. The work is still the same, and people are doing the work to the levels that they can do, and the ways that they can meet that work. And if they do have any issues, then they can speak to their line managers about any issues that they do have in terms of timelines. So I don't really see. I'm working from home 1 day a week. I need to be on my site 4 days a week, but there are members of our team, my team, that are working from home 4 days a week. So, and they're still making the same timelines. So it depends on the role that they're doing, and those any issues that they have, then they would speak to their line management. If you can see and hear me fine, I'm not unsure. There's no connection from my side. So if there's no more questions, then I think that I will go. And thank you so much, CIPM, and thank you everyone for allowing me to speak to you all today. Be safe and look after each other. God bless. Thank you so much. Goodbye.